Hey guys, this is Thomas Wells, the body mechanic. I'm going to talk to you a little bit today about the ankle. So restrictions at the foot and the ankle are one of the most common reasons for pain and dysfunction in the body. They're kind of where the rubber meets the road. So if you have problems there, it tends to create problems all the way up in compensation. One of the most common problems I see is a lack of dorsiflexion at the ankle, and that's the ability to bend at the ankle like this, okay? You could think of it as stretching your calves. But oftentimes that lack of dorsiflexion is not caused by tight calves or even a tight Achilles. Oftentimes people lack dorsiflexion because of this bone right here. This is the talus bone. Show that to you right there. Okay, so it sits between the shin bone and the heel bone there. And what can often happen is due to tightness of ligaments around this shin bone, when you bend the ankle like this, the talus isn't able to slide backwards the way it's supposed to, and you get a jamming effect in here. And what people often feel when they do that is when they try to even stretch their calves, it feels like they're hitting a hard stop, like they can't even get the stretch that they're trying to get. So the key here is to be able to open up these ligaments back here. Okay, so that's ligaments like the posterior talofibular and posterior tibiotalar ligaments and a few others back there that are the primary restrictors, and they keep that talus from sliding back, so it ends up stuck forward, and it ends up like trying to close a drawer that has something hanging out of it. You can't get the drawer all the way shut. In this case, you can't dorsiflex the ankle all the way. Okay, so I'm going to show you some stretches for this. Okay, so for this, you're going to want some kind of long stick. So it could be a broomstick, a dowel rod, a curtain rod, whatever. It doesn't really matter. It's just kind of a prop in this, but it's very useful. So you're going to get down into a kneeling position. We're not going to do any of the straight leg stretches here like we normally would for the calves, because we actually don't want tightness we actually don't want the calves to be part of the stretch. Our target is those ligaments. So by bending the knee, it helps eliminate at least the gastrocnemius, which is the main muscle of the calf that you can see on the back of the leg there. Okay, so to do this stretch, the basic motion is going to be sort of a forward lunging, but we're going to do it at oblique angles that really help selectively target those posterior ligaments. So what you're going to do is you're going to put this stick, you're going to place the stick kind of right next to the big joint of the big toe. Okay? And then as you lunge forward, you're going to move your knee to the opposite side of the stick, kind of lunging like so. And you make sure that the heel stays down. And you want the back knee forward enough that you feel like it's still holding a lot of your weight, because you don't want all your weight on the front leg. You don't want it holding you up. It's hard for things to relax if they're actually holding you up. So lunging forward like that, you're not going to feel a sharp stretch, like a real pinpoint stretch like you do with muscular stretches. It's going to feel much more diffuse, but I assure you it's going to put the tension where it needs to be. You're going to lunge forward, and you're going to hold that for about a minute. And you'll notice I'm using the stick also to help kind of hold myself up, because again, I want enough body weight in there to create the stretch, but not so much that my foot the muscles around my foot and ankle are forced to really work to hold me up. And then what you're going to do is the reverse of that, moving the stick to the opposite side by the little toe, and now my knee is going to go to the outside of the stick. So my foot and my knee are always on opposite sides of the stick. And then same thing. Now on me, this one's a little bit tighter. This is creating more of a stretch on the ligaments on the inside of the rear of the talus there, specifically the posterior tibiotalar. And you're going to lunge in like that. I'm going to move my back knee a little more. And then you're going to hold that for a minute. And you're going to make sure that your heel stays down. If you're allowing the heel to lift, you're losing the stretch. So that's important to maintain. And what you'll notice after doing that pretty regularly, you're going to have an easier time bending the ankle, and then even an easier time doing like calf stretches, whether it be for the gastrocnemius or soleus. You'll have better dorsiflexion. And that's important for a number of reasons, but specifically when people lack dorsiflexion and they aren't able to move that way when they're walking, running, bending, whatever, you have to compensate. You have to do compensatory movement. And the way people tend to do that is either by rolling the foot inward around the big toe or walking on the outside of the feet. And sometimes you can look at the bottoms of your shoe and you'll see the wear pattern on the outside of the foot, and that'll show you what your strategy is. And if you do resistance training and you do motions like squats, restriction here will tend to lead to people not being able to get as deep in their squat, but also they're going to have to either kind of buckle the knees in, or they're going to have to lean much further forward in their squat because they're not going to be able to get enough motion at the ankle to be able to keep their center of gravity as far forward as they want. So they'll have to shift their weight back more and then lean forward to counterbalance. So when you're squatting and you're further forward than about a 45-degree angle, there's a good chance, because you have to, because you have no choice, that's probably caused, at least in part, by restriction at the ankle. And this is one of the most common reasons I see for a lack of dorsiflexion in the ankle. And it's the one that things like foam rolling and static stretching for the muscles isn't going to get. Okay? So I recommend you give this a try. This is good movement prep, if nothing else, that you can do before you train, before you do other exercises, is just to make sure you have good foot and ankle motion, and it'll just facilitate everything else you do. So hope that was useful for you, and I'll see you next time.